BC's poison drug crisis continues to wipe out more lives. The coroner says 175 people are believed to have been killed by them in September. That's 10% less than the number of people killed in September last year, but it is still almost 6 people every day. Most of those deaths were reported in Vancouver, Surrey, and Greater Victoria. The toxic drug crisis has now claimed more than 13,000 lives in this province alone since 2016. Now, the numbers coincide with another report from a panel of experts tasked with looking into BC's toxic drug deaths. One of the recommendations is removing the prescription requirement to broaden access to safer supply. Tanya Fletcher joins us now with details. Tanya, what exactly are they suggesting?
Well, Dan, this is the third review from this panel of 21 experts looking into these drug deaths, and here are their recommendations. This is out of the Chief Coroner's latest report. First and foremost, they're asking for a safer supply outside the healthcare system. That's key. We'll get into more on that later. Also engaging more with people who have lived experience to learn from, and more funding to work with Indigenous leadership on finding solutions. Now, that first one, shifting safe supply outside the medical system, is really the big one. Right now, safer supply options have to be administered by a doctor or a nurse, but the report says 20% of British Columbians don't have a health provider, and more than 200,000 drug users in the province have no access to the safe supply options that currently exist.
Safer supply is not a radical initiative. It's a means to keep people alive and to support them to wellness. It's a means to reduce our loved ones' dependency on a toxic, profit-driven, illicit drug market. It is life support.
Tanya, how are these recommendations being received by the provincial government?
Yeah, that's always the question. You can make as many recommendations as you want, but will they ultimately be adopted? And doesn't sound promising in this case. BC's Minister of Mental Health and Addictions has essentially rejected the idea of a non-medicalized supply. In a letter to the Chief Coroner that we just heard from, thanking her for the report, Jennifer Whiteside writes, non-prescription models for the delivery of pharmaceutical alternatives are not under consideration, it reads. Accordingly, she says, I cannot accept the primary recommendation of this report to pursue a non-prescribed model of safer supply. That's from the minister. Now, this is one policy stance that the opposition seems to actually agree with on the NDP.
It's also one of the major models that was rejected by the Stanford Lancet Commission, and it's not a model that is used in other locations that have been successful in tackling significant drug problems. I find it really concerning. We need to continue to address this as the medical issue that it's been identified as.
Now, put all of this in the context of toxic drug deaths, now double what they were in 2016 when BC declared it a public health emergency. Dan?
Tanya Fletcher joining us live tonight. Thank you. Well, toxic drugs don't just kill people. Those who have overdosed on them and survived are sometimes left with long-lasting injuries. Yvette Bren meets those whose lives have been crippled.
Hey, what's the matter? Hey, you miss me?
Hugh Lampkin began using drugs from pot to PCP to escape when he was about 12 years old, growing up in Toronto.
You know, you got to walk a mile in a man's shoes to know exactly what's going through his head.
Years of using drugs helped deal with memories of abuse.
I didn't get any joy, but I would get comfort. Like, I was able to cope and deal with things.
But a year and a half ago, he had a bad fall.
When I went to stand back up again, I couldn't stand up straight, and it's been there ever since.
He's one of thousands of Canadians with chronic health issues related to past opioid abuse or overdoses. According to the Canadian Institute of Health Information, in 2022 to 2023, there were close to 6,000 Canadian overdoses, and 327 left people with anoxic brain injuries or brain damage due to a lack of oxygen. Some who don't overdose end up with infections which can lead to damage of organs or bones.
If it spreads to the bones, causing an infection called osteomyelitis, it will cause the bones to collapse so that people will have collapsed spines, not be able to stand up straight, not be able to walk properly.
Injections can introduce infections. These can spread, causing abscesses or sores. Lesions from drug use can be aggressive and lead to amputations.
This is the office. My desk.
Experts say more study is needed to help people like Hugh heal and rehabilitate.
And I went to see a specialist about 2 weeks ago, and he came out of the room. And when he came out of the room, I knew I just knew by his face that they were going to say no. And he was saying the reason that they're not going to operate is because when I was younger, I was doing drugs.
Many aren't considered for organ transplants or complex surgeries, like Hugh, who no longer uses drugs. But he says he has so much more to give to help others escape addiction. Yvette Brand, CBC News, Vancouver.